Today, I don't go live often, but you guys know when I do, I got something great to talk about, and I have a special guest joining me today. Oh, there she is.
Hi, Koya.
Hi, Dr. Charlotte. How are you?
I am doing so good. So great to be on with a fellow Orlando. I don't even know what to call it. Orlandoan?
Yeah, we'll go with that. We'll go with that. Yeah, I was so excited to find out that you're from Orlando as well. I was like, we have to link up.
Absolutely, Koya. I see that you've been running the city, and my husband, he was like, "Oh yeah, you don't know Koya?" I was like,
I love that. I love that. Okay, so before we get started, I do want to let you guys know that this session was developed by Vindico Medical Education with an educational grant support from Gilead Sciences, and more project information can be viewed in the link in the comments, which I am dropping right now. So yes, Dr. Charlotte, finally happy to be talking to you.
absolutely.
For people who are not familiar with you, could you tell us who you are and give us like a little rundown on what it is that you do?
Yeah, awesome. Thanks, Koya. So my name is Charlotte Roll. I'm an adult infectious disease physician, mostly a physician researcher. And so I do a lot of clinical trials related to, therapeutics and in HIV prevention, cure. A lot of the STDs fall in my wheelhouse. And so it's a lot of fun, Koya, because I get to deal with sex all day.
Yeah, a lot of fun, a ton of fun. And you get to educate people more importantly.
Yes.
Yay. Okay, so today is going to be like a Q&A style discussion, guys. So if you have any questions, feel free to drop them in the chat. And throughout this live, we will be sure to get to them. Also, you can find this session placed on the Vindico Medical Educational's Instagram and YouTube if you want to go back to review or if you want to share this with anyone. Their Instagram is at Vindico_live. So yeah, I think for the most part, everyone knows who I am, but just in case you don't, my name is Koya. I am certified to test and counsel when it comes to HIV. I also work hand in hand with the Florida Department of Health, specifically with their HIV and AIDS initiative. I have a podcast that encourages you to talk about your sexual health with a hyper focus in helping people who are HIV positive tell their story. And then I also have a dinner party that tours the United States, educating Black women about
Oh,
HIV
awesome.
prevention options. So this conversation is near and dear to my heart
Absolutely.
for
Yes.
all of the reasons that I just mentioned. And I'm excited to be communicating with you about communication with clinicians about HIV prevention. So let's hop straight into it. So, as we both know, we're both in Florida, in Orlando. But specifically when it comes to Florida, once we get to the southern regions, it gets a little, those numbers start climbing a little
hmm
high, specifically when it
hmm
comes to like Miami, Fort Lauderdale, Palm Beach, that area, right? And I think this is where talking about PrEP is very imperative because I think it's a key in helping some of these numbers get down. So, before I get into any of my questions, familiarize our audience or remind them what PrEP is.
Yeah, Koya. So PrEP. PrEP is the use of medication. Specifically, we're usually talking about antivirals that we use to treat HIV. There are certain antivirals that we also have approved as PrEP, right? And so it's taking those medicines before you get exposed to HIV, right? So the PrEP stands for pre-exposure, before you get exposed to HIV to prevent, HIV acquisition. And that is through sex, Koya, but PrEP is also for reducing your chances of getting HIV through injection drug use, right? And so both of those, we've studied PrEP in both of those contexts, and I think people often forget about that. So I just want to remind the audience about that.
Yeah, great point. Great point. So, if someone is interested in PrEP in Florida, do you have advice on how to bring up PrEP to their healthcare providers or where they can find a provider?
Yeah, Koya, like you said, Florida is like a hotbed. And South Florida has literally been like number one in the past like three HIV surveillance reports. And like DC kind of like, is like egging it, back down to like number two right now. But South Florida is really kind of a little bit of a hot mess. Orlando has actually also been in the top 10 for the last few reports now as well, because there's a lot of back and forth between Orlando and
Mm-hmm.
Miami. We share the same pond, Koya. We really do, right? And so Orlando, I'm never bored at work. I think I saw 5 new HIV cases last week. Like that sucks. That's a lot for a single clinic to see in a week. And so we really are sitting in the hotbed of HIV in the South. And as a result, Koya, a lot of providers here are actually familiar with PrEP. This is unlike other parts of the country, right? Where like you're going to go to a doctor and they're going to be like, PrEP? Like what? Like what's that? That's actually not the case here in Florida. A lot of us prescribe it. A lot of us are aware of it because I think a lot of providers in Florida are aware of the issue that we have with HIV here. And so I do think it's probably like a little easier to find a physician or a provider who may be familiar with PrEP here. But I will say that people who are interested or who want PrEP, it sucks, but the onus is almost on them to bring it up to their healthcare provider, right? And that shouldn't be. The CDC says that we should be offering PrEP to everyone who's sexually active. Like we should be at least talking about it and letting people decide if that's what they want. But that's not what's happening, Koya. So I have to encourage your audience that if you even remotely think PrEP might be right for you, you have to put it on the agenda for the visit. You got to go into the provider and say, hey, is it okay if we talk about my sexual health today? Can we just carve out a few minutes to talk about my sexual wellness today? Because there's something I want to talk to you about. And again, I hate putting that on the patient, but I think that that's the most proactive way to ensure that their needs are being met during that visit.
Also, you are your best advocate when it comes to your body. You know what I mean? I remember at one of the dinner parties that I hosted, a girl spoke up and said, hey, I went to my provider and I asked for PrEP. And he or she was like, oh, that's not for you. You don't need that. And that's crazy to me because if I'm here
Absolutely.
advocating and telling you this is what I want, and then you as my provider are telling me I don't need it.
Absolutely. That's wild. Like that young lady, I hope she fires that provider and I hope she seeks someone else who may be like more appropriate because that's like ridiculous, right? If someone's coming to you and telling you or even asking you about PrEP, like it actually like doesn't even matter what they're doing in their bedroom. The fact that they sitting there asking you and wanting to know more about PrEP, it actually suggests that you should just write the prescription, right? Like it doesn't matter like how much people they're having sex with, what kind of sex they're having. None of that matters. If you are interested in PrEP and you live in the state of Florida, guess what, Koya? Your chances of encountering someone with HIV are very, very high. It doesn't really matter like what you're doing in your bedroom. It's about numbers at that point, right? You playing a numbers game and you swimming in a pond with a lot of HIV. Like people, deserve PrEP who want it, regardless of what they tell their providers their reasons for PrEP are.
You are absolutely right. Do racial disparities in PrEP access exist, and what is their potential impact on the HIV epidemic?
Oh my God, Koya, this is something I was really passionate about when I was at Emory and did a lot of work in PrEP disparities, So obviously, right, in communities of color, yeah, we have lower awareness, we have lower education about PrEP, and for the most part, we also have lower access. So those are like the obvious, right, ones. But Koya, in communities of color, we also have those pesky social determinants of health that people talk about that are just way more pervasive: financial instability, housing instability, homelessness, stigma, racism, homophobia. Like all of those things are also more pervasive in communities of color. And so all of those things affects the chances of someone getting on PrEP. And it sucks because those are the communities that are most impacted by the HIV epidemic. And so if you think about it, the people who need PrEP the most are the people who are not getting it in this country. And so even though we have this amazing and wonderful prevention option, if we're not getting it to the people who need it the most, Koya, all we're going to end up doing is seeing worsening of these disparities in HIV, right? And like that's not the point of PrEP. Like it was invented and intended as a tool to help us bridge those disparities, but unfortunately that's just not how it's going right now.
Yeah, and it's so unfortunate. I hear so many people, like I said, I have a dinner party that tours all around the United States, and no matter what area I go to, when I advocate and tell people about PrEP, they're like, oh, I can take that. That's for women. And that's another misconception that PrEP isn't for women. And it's like, yes, you have access to this as well.
Absolutely, Koya. So we have oral PrEP, oral daily PrEP, a pill you take every day, and injectable PrEP. Both of those options are approved for women, right? Like, I mean, like women can take either or,
Yeah.
right? It's not just one or the other. And so, Koya, this is our bad. Like that when we came out with PrEP in 2012, we actually only marketed it to certain demographics, and that's our fault. Like, I'll take the blame for that. Like the community, the ID community is going to take the blame for that. Okay, we like didn't do a great job, and so here we are, 13 years later, Koya, trying to play catch up. Like that's literally all we've spent the last 13 years doing, trying to play catch up with the communities that we kind of missed the boat on off the bat. And cis women is one of those communities, one of those populations, especially Black women, continue to be disproportionately impacted by new HIV cases, but yet is sorely underutilizing PrEP, And that's why I'm so glad that you and the other influencers have allowed me on your platform to really kind of talk about this and bring awareness to this issue, because obviously this community that you and I both belong to, and so it is near and dear to our hearts. And if we can get more Black women on PrEP, like even if we get one tonight, Koya, like we've done a good service tonight.
Yes, and let's talk about how well does PrEP work when it comes to preventing HIV? Because I know that's going to be a lot of people's
Yeah.
questions.
Yes. People are not going to take something if it doesn't work, honey. It's not going to
Yeah.
happen, right? So, in terms of when we're talking about getting HIV through sex, okay, we have a lot of data at this point that says if you take PrEP as it's prescribed, so medicines, Koya, they only work if you actually like take them. People often forget that, but that's all right. It is actually we think it's up to 99% effective at preventing HIV infection, right? And so that's sexual acquisition. If we're talking about injection drug use, we have fewer studies on injection drug use, but we think the number is somewhere around 74%. And 74% is still a substantial number, Koya. Like that number, really translates into a very meaningful public health impact, And so, again, the providers, I'll take some of the blame. We are not doing a good job of informing all sexually active adults and adolescents about PrEP. CDC put that on us. We are supposed to inform all sexually active adults and adolescents about PrEP. We're not doing such a great job of that. And so I have to put the onus back on the patient. And like you said, people should be proactive about their health, but many people are not, and so hopefully if someone hears this tonight, maybe we will motivate someone to go into their healthcare provider and ask them to have a discussion about PrEP.
I truly hope so. That is the goal. So we talked about how well it works. Now, what if someone were to have concerns or hesitations? How do you address concerns and hesitations that people may have about starting PrEP?
Yeah. So I give a little spiel about PrEP. I think everyone who prescribes PrEP has the little spiel, right? Like you go through it, how well it works, how you got to take it, what's the dosing requirements, what's the follow-up required to, kind of stay on PrEP. And then you have this whole spiel about side effects, so you kind of go through your little thing in your mind. And, at the end of that, I will often like turn to a patient and be like, okay, I said a lot of stuff today, but I need to hear from you. What is going to stop you from either starting this drug or staying on it? And like, let's formulate a plan about that right now so that there are no surprises when you start it. And if you encounter an issue, you already have a solution. Like you kind of already know what to do, right? And very often it's questions related to side effects. And so we kind of come up with mitigation strategies. I'll give you an example. Oral PrEP, a lot of GI side effects at the beginning for some people, not everyone, but for some people, stomach upset, loose stool, etc. Guess what, Koya? If you take your oral PrEP with food when you're first starting out, you have a lower chance of experiencing that, right? And so you try to anticipate a little bit and provide solutions up front. A lot of people are worried about whether they will lose access to PrEP. Like, how will they continue to get PrEP if they lose their job, if you know, something happens to their insurance, or if they don't have insurance, like if they're in some sort of funded program, what's going to happen to that, you know? And so you kind of try to come up and anticipate those problems before they occur. It helps patients feel more confident.
Yes, I love that. Dr. Roll, I am so thankful that you joined me today to have this discussion. It's easy for me to get out here and advocate for these things, but I think when someone hears from an actual doctor, I think it hits a little bit different. So that's why today's conversation was so imperative for me to sit with you and have for my audience to help give them an added layer of protection when it comes to, you know, just being sexually active, because anyone who is sexually active is HIV possible.
Yep.
So as I posted in my video before, yes, abstaining is great, but not everyone makes that choice. Condoms aren't always effective, so why not have PrEP as an added layer of protection for you to make sure that you are not HIV positive. So I just want to thank you so much for joining me today, discussing and communicating with clinicians about HIV prevention. Just a reminder, this live will be on the Vindico Medical Educational's the Vindico Medical Education's Instagram and YouTube, along with other lives from this series. And if you guys are interested in getting PrEP, there is a link in my bio that can give you a tool to help locate a PrEP provider near you and learn more about PrEP. Dr. Roll, thank you so
Thanks
much.
for having me, Koya. Continues to do the good work and fight the good fight.
Thank
Okay.
you so much. I'll talk to you later.
Bye, Koya.
Bye.